Dr. Brian J. McKinnon is a board-certified neurologist, otologist, and ear surgeon, and he's written a wonderful little guidebook on hearing loss and recovery called Life is Worth Hearing. I've really had a good time reading the book. It's a very easy read, a little bit less than an hour, even with interruptions, and we're going to talk to Dr. McKinnon now about why you've written this book.
Well, the intention, of course, was to write it for patients. I spent a lot of time writing to other providers in our big, long words. But the reality is my patients don't need to know the big, long words. They need to know what they can do to help with their hearing.
Why don't people get their hearing tested as often as, say, they get their vision tested?
Well, one primary reason is they're not asked to or told to or directed to. We all get asked to make sure we get our blood pressure checked. We have campaigns to get people to get their vision checked. But often there is a cursory discussion with the healthcare provider. How's your hearing? Oh, it's okay. And there's no emphasis saying, well, you haven't had a hearing test in X many years. Well, certainly if you haven't had your blood pressure checked in 6 months, they're going to check it whether you were normal before or not. But with hearing, often there is this, oh, it's okay, so therefore we don't have to do anything. So there's very little attempt to be proactive in addressing hearing loss.
You quote Helen Keller in regard to hearing loss as opposed to blindness. Tell me a little bit about that.
Well, Helen Keller is a local girl. Of course, she grew up over in Muscle Shoals in Alabama. And her story is one of remarkable good fortune of a family that was able to identify somebody, Ann Sullivan, to became her caretaker and her teacher, and really a companion for her life. Helen Keller, who was both deaf and blind, who ended up going to Radcliffe for education, was able to articulate the impact that those disabilities have. And as she said that blindness separates us from objects. But it was the hearing loss, the deafness, that separated her from others, from other people, the inability to communicate.
How important is hearing everything that your friends, relatives, and coworkers have to say?
Well, think about what can go awry if you don't hear everything that is said. There are plenty of cartoons that start with the punchline, did he say we'd be okay someday or Sunday? Not being able to hear what's being said to us can be even dangerous. Everything from communicating how to take medications to safety features during a drill, in the class if you can't hear what the teacher's teaching. All those have a profound adverse impact on our ability to function and participate.
How can you tell if you are experiencing hearing loss?
Well, the primary thing you would experience is having to ask for things to be repeated to you. If there are individuals who you've known and have conversed with for years and suddenly you're having difficulty or having them repeat, or, for example, under circumstances that you would normally have little difficulty in hearing a conversation, such as the dinner table at Thanksgiving, if you're suddenly losing out on the conversation, you probably need to get your hearing checked. If suddenly people are mumbling about you, it may be not their articulation, but your hearing that's the issue.
When people do discover they have hearing loss, why is it often so difficult to have them get and use hearing aids that could help them so much?
Well, it doesn't just apply to hearing loss. There are many conditions where people find it very difficult to face reality and to make changes that can sometimes seem very daunting. Hearing loss is just another case. How often do people not want to change their diet to reduce their cholesterol? How many people don't want to take their blood pressure medications because they may not feel very good? Fairly common issues in healthcare where we don't want to necessarily have to address what's going on, but there's a second aspect to it. Nobody is likely to be criticized for having blood pressure issues. But people may be looked at differently if they admit to and then try to manage their hearing loss. Hearing loss is a condition that many people who have it will find that others will find them less serious, will almost be dismissive of them, because the hearing loss to them means some form of diminished intellectual ability or a limited ability to perform the tasks they were doing before, even though that hasn't changed.
What is hearing aid stigma syndrome?
It's very simply the case of individuals who would benefit from a hearing aid but refuse. It's very common during seeing patients for the family to have brought the family member in. The family is saying it's very difficult to communicate with mom or dad. They're not getting the conversation at the table, or worse, there are lots of issues we got to deal with, let's say for settling estates or dealing with business, and they're not hearing. And we go through the hearing test and we discuss the hearing loss, and they turn around and say, "Oh, no, I don't need a hearing aid." This is a personal issue. I have a mother who is in her late 80s, excellent health, has no problems with her hearing. Everybody else has a problem with her hearing, but she has no problems with her hearing. And so it's a very real challenge that people suddenly feel that if they admit to having the issue and they take it seriously and address it, somehow that's going to cause greater harm than good.
If someone tries standard hearing aids and they're just not working for them, are there other options?
Well, the first thing is to make sure they've been fitted with the right form of a standard hearing aid. There are many, many different types of hearing aids. Those that go completely in the ear, those go behind the ear. And you also have to make sure that the hearing loss they have may not be amenable to surgery. There are some forms of hearing loss that we can address through surgery, sometimes very simple surgery. Unfortunately, there are some forms of hearing loss that a hearing aid are not appropriate for, and those can be addressed through implantable devices such as a cochlear implant or with bone-anchored hearing aids. And anybody who is uncertain about cochlear implants, as many know, the commentator Rush Limbaugh is a bilateral cochlear implant user, more impressive by the fact that he is a radio personality. And so therefore hearing is critical to his ability to perform his job.
What is a cochlear implant?
A cochlear implant is a device that is driven by electrical charge. It has an electrode that goes into the inner ear. It has an internal processor that goes just under the skin behind the ear, and then an external processor which actually contains the battery and takes the sound from the environment and converts it to a digital signal. The digital signal gets sent via radio frequency to the internal device, and that device sends it to the inner ear as an electrical signal. The cochlear is unique in that snail, if you unrolled it, goes from low frequency to high frequency, not unlike a piano keyboard. And so the electrical current on those contacts will strike the notes, shall we say, of that piano keyboard, so the person can perceive sound.
Do you perform cochlear implantation?
I've been doing cochlear implants since the late 1990s when I was in training, and have been managing cochlear implant programs now for well over 15 years. So I've been very fortunate, and it's really one of the more rewarding aspects of my practice.
Tell me, what is a bone-anchored hearing aid system?
A bone-anchored hearing aid system is a rather unique device, and what that does is it uses a fixture that goes into the skull, and this becomes osseous integrated with the bone, and then you attach a hearing aid to that, and it uses the bone to transmit sound through the bone to the inner ear. And it can be used to treat people who are of good inner ear function, but their middle ear or the middle ear bones don't work. Or in individuals who are deaf on one side but have good hearing on the other, so the sound gets to the functioning inner ear.
Are cochlear implants and bone-anchored hearing aid systems covered by Medicare?
Yes, both cochlear implants and bone-anchored hearing aid systems are covered by Medicare.
Are standard hearing aids covered by Medicare?
Standard hearing aids are generally not covered by Medicare unless you have some of the Medicare Advantage programs, and they often have a hearing aid benefit.
Tell me, can hearing loss be prevented?
Yes. We know that people who use hearing protection around loud noise can markedly diminish the trauma that occurs with noise exposure. And noise exposure is probably the leading cause of hearing loss in the Western world. When we look at teenagers and the advent of the MP3 player, we're seeing a rate of noise-induced hearing loss of about 19 to 20% in that age group, all because of the use of the MP3 players and the turning up the volume associated with adolescents and their MP3 players.
How often should everyone have their hearing tested by an otologist?
Typically, they have a hearing screening done at school, so certainly their school screening should be done and supported if they do have a screening system. If the school system doesn't have a screening program, that should be done as part of the school screening. Certainly, it would make sense at any time when someone has a hearing loss, they should have their hearing evaluated immediately. It may be a minor issue, maybe some wax in the ear canal, or it can be something more concerning. Once we get into the age of 65, as we get older, then we probably need to start considering getting a routine hearing test every 3 to 5 years.
Now, what should someone do if they notice that a loved one, friend, or coworker seems to be experiencing hearing loss?
We'll certainly encourage them to get the hearing tested. And sometimes that can be a challenge because people don't want to admit they have a hearing impairment. But the first thing to do is, this is important. It's important that I'm able to talk with you and you're able to communicate back, and want to make sure that your hearing is doing okay.
Can hearing loss itself actually lead to depression?
Hearing loss doesn't necessarily lead to depression, but can certainly contribute to it. Because hearing loss, as Helen Keller said, separates you from people. A person who is depressed is already having struggles maintaining those contacts. You add a hearing loss to it, it's going to compound the issues that may be contributing to the depression. The inability to feel part of, the inability to communicate and be communicated to. Certainly those who have had a sudden hearing loss will feel and mourn the loss, and many times the sudden hearing loss will lead to depression because of the loss of connection that has occurred.
Can hearing loss be dangerous for patients and the people that they live with and work with?
Can be. If you cannot hear the warning, if you can't hear the horn on the car that's beeping to tell you to get out of the road, obviously that can be extremely dangerous. If you can't hear how to take your medications correctly, and you end up taking your medications incorrectly, that can be very, very dangerous. So hearing loss can be a significant contributor to safety.
Can hearing loss affect the overall quality of a patient's health care if they can't hear what their doctor tells them to do?
Not just the quality of their health care, but the quality of their lives. There's a lot of very good evidence that hearing aids improve quality of life. There's some excellent evidence that cochlear implants improve a person's quality of life. And I know that many people will say, well, they're old, how can they possibly benefit? But there's excellent evidence that amplification and cochlear implants can reduce or slow the cognitive decline that's associated with aging. And obviously can improve the quality of life of those that have a hearing loss that's now treated.
Do you think all medical practices should provide the information found in your book to patients?
Medical practices obviously want to take care of their patients, and they're going to discuss not smoking, and they're going to discuss their weight, and they're going to discuss the blood pressure medications. And how is that patient going to learn from that if they can't hear? So obviously, talking about hearing is as critical as talking about the other factors. And so yes, hearing should be a very key part of that discussion.
What is the role of a caregiver in helping people they care for realize they have a hearing loss and that something can be done about it?
Probably honesty is to be sitting down with the person saying, this is an issue. This is causing a problem. And we want to make all of our lives easier. And so honesty and not stepping around or ignoring the elephant in the room is probably the best way for the caretaker to address it. And that goes with any health issue, whether it's changes in overall health, changes in the person's activity. They have to be dealt with honestly.
What are the top things everyone should know about hearing loss, prevention of hearing loss, and recovery of hearing?
Well, the most important thing about hearing loss is that you need to be vigilant for it, and you have to be proactive about it. You have to be honest with yourself and honest with those around you that if you're having a problem or others are having a problem, it needs to be evaluated. It's not something to be dismissed or made fun of. In terms of preventing hearing loss, the most important thing, quite frankly, is good routine health maintenance. If you maintain good health, proper diet, proper weight, good blood pressure, low blood sugars, those are all going to be important. Most important in the Western world is avoiding exposure to noise. That means if you're engaged in activities that include noise, let's say you go hunting, wearing hearing protection when shooting the gun. If you're going out to clubs, going out to music venues, hearing protection during those music events. With your children, having them turn down the volume of their MP3 players. If you can hear it, it's too loud if they're wearing it. And so those are the things to keep in mind. Even some activities such as mowing the lawn. How often do people put their MP3 players in? They turn up the volume of the MP3 player to overcome the volume of the lawnmower. That's probably not the wisest thing to be doing. In terms of addressing the hearing loss, recognize that there are options that are effective at helping them hear. They can involve hearing aids. They can involve the use of listening skills. They may involve bone-anchored hearing aids and cochlear implants. But we have a number of very good options that work to address the hearing loss.
Individuals and medical and healthcare practices can get free copies of this book. So can assisted living and retirement communities, religious groups, businesses, veterans service organizations, unions, and associations. Contact Robert Carroll Publishing at 901-626-2487.